Epilepsy is one of the common disorders. Apart from epilepsy, we do see in neurology wards and OPD headache cases. Then we have a stroke. The stroke is extremely common. Stroke is nothing but paralysis of the limb, and that is very, very common. Epilepsy is due to an abnormal electrical activity. A newborn baby, even till the end of the life, they can be affected with epilepsy. It is a common disorder, but lot of stigma is there. Lot of stigma in the society about this disorder. That is the reason we need to create awareness among the public regarding this disease. And usually we say in 70% of the cases, we don't know the cause. And that cause is known as cause not known. By eating a food on the roadside. For example, people all eat pani puri, yes, which is very, very common. But at the same time, you can carry some infection, and that infection could be in the water, and that produces what is known as tapeworm infection. And that tapeworm infection is one of the causes for epilepsy in adult people, in older people. Age advances, in a woman, always the bones become very brittle. The bones become brittle, the bones become thin, and that is the reason where the anti-epileptic drugs, what we use, also should be careful. Just like your blood pressure, just like diabetes, we can treat epilepsy. There are very well treatable, good, effective drugs are available in the market now. Then those patients from that area we can remove. But identification requires lot of investigation, and once we do all these investigations, then the patients can be identified and those patients can be subjected to surgery. Epilepsy person can lead a normal life like anybody else. They are as normal as I and you. So there is no difference at all. They can definitely marry. Only thing is, what I suggest always is, please inform.
नमस्कार, मो डॉक्टर संतोष कुमार दास किम्स स्नायुरोग विभाग रे प्रोफेसर एवं विभागीय मुख्य भाव काम करुच्ची। आज ये भिडियोटी एथिपाई तैयारी होची कि मो सांगरे मोर टीचर एवं टीचर्स मानकर मध्य टीचर बहुत रेपुटेड न्यूरोलॉजिस्ट आम भारत दीर्घ 40 वर्ष धरी एक्सपीरियंस, बेसिकली मुख्यतः फिट्स बा बात रोग रे जहाँकर 40 वर्षर अभिज्ञता, से ओडिशा को भुवनेश्वर को आम हॉस्पिटल को आसुछंती। तांको संगरे किछिटा कथा जहार कि मुख्य लक्ष्य है पेशेंट माने केमती अवेयर हंतु, एपिलेप्सी रोग संबंध रे जेमती समस्तक मध्य सचेतनता व्यापू, समस्त केमती ए रोग को जानतु, तार ट्रीटमेंट, तार चिकित्सा प्रणाली कौन कौन अवेलेबल अच्छी। कारण बहुत समय आम देखुचु एपिलेप्सी संगे बहुत अंधविश्वास जोड़ी होकर रोचे, जहाँफल कि आम पाखक जो रोगी मैंने आसुँच बहुत विलंब आसुँच एवं बहुत भूल ट्रीटमेंट थांती। सर आम पाखक बेंगलोर प्रति मासरे आसुँच एपिलेप्सी बा फिट्स पेशेंट देखापी। यही डिस्कसन माध्यम आम जाना सार शुणा कि एपिलेप्सी कौन, तार कौन कौन ट्रीटमेंट अच्छी एवं यहाँ को समस्त मध्य ए न्यूज केमती स्प्रेड आम करिपरिबा कि रोगर चिकित्सा संभव एवं एथि सहित थिबा समस्त अंधविश्वास आम किपरि दूर करिपरिबा। अबे आम सार मुठो सुनिबा।
सर, फर्स्ट ऑफ ऑल वेलकम टू ओडिशा एंड वेलकम टू भुवनेश्वर। सर, हाउ डू यू फील एंड प्लीज इंट्रोड्यूस yourself to our viewers.
I am Dr. Satish Chandra, as the professor and senior professor of neurology and former director and vice chancellor of NIMANS, currently working as an advisor in Apollo Hospital at Bangalore. I visit here every month as an emeritus professor in KIMS Kalinga University at Bhubaneswar.
Sir, as you visited so many hospitals and so many places, sir, what do you find special or what do you find the basic unique things in Odisha and these hospitals and this environment?
See, the most important is this Kalinga University and KIMS Hospital is very well known now, and this KIMS University has helping so many poor patients from all over the state of Bhubaneswar, Odisha. And the problem here, most important, is this institute provides most of the whatever required in neurological services almost at a very nominal charges. And that is very, very important. So poor people is able to come over here and get the benefits from very well trained and experienced hands which is available in this place. And all the technology as what is available in any other parts of the country, like in Bangalore, is available here now. So the people can come over here and take the best expertise available in Odisha, in Bhubaneswar, and then carry home, and they can take the treatment what is available here, and they will be benefited to the maximum extent. They need not have to travel all the way to either to the south, to Bangalore or Chennai, or to the north in Delhi or Calcutta. That
Sir,
is not required.
as so many times you visited our patients and Odisha's patient, ଆପଣ ମାନେ ଜାଣିଥିବେ କି ଯେତେବେଳେ କମନ କଜ୍ କ'ଣ ରହୁଛି, ଯେତେବେଳେ ଆପଣମାନେ ଏପିଲେପ୍ସି ପେସେଣ୍ଟ ମାନଙ୍କୁ ଦେଖୁଛନ୍ତି ତ ମୁଖ୍ୟ କୋଉ କୋଉ ଟାଇପ୍ର ପେସେଣ୍ଟ ମାନେ ଆସୁଛନ୍ତି ଏବଂ ସାର୍ ଯେତେବେଳେ ଦେଖିଛନ୍ତି ଅନେକ ପେସେଣ୍ଟ ମାନଙ୍କୁ ତ ଦ ମୋଷ୍ଟ କମନ କଜ୍ ଦ ମୁଖ୍ୟ କାରଣ ଯେଉଁ ଆମେ ବେସିକ୍ ଯେଉଁ କାରଣ ଗୁଡ଼ିକ ରହିଛି ଏବଂ କୋଉ କମନ କାରଣଟା ରହିଛି ଯେଉଁ ପେସେଣ୍ଟ ମାନେ ଆସନ୍ତି?
Yeah, the common causes what we see here in Bhubaneswar is epilepsy. Epilepsy is one of the common disorders. Apart from epilepsy, we do see in neurology wards and OPD headache cases. Then we have a stroke. The stroke is extremely common. Stroke is nothing but paralysis of the limb, and that is very, very common. Then we do also see other conditions like infections which affects the brain as well as the spinal cord, and the nerve disorders which are affecting the limbs. So the neurology is a very common system which gets affected. Brain and spine are the centers which gets affected for various causes. Now we say almost about 15 per thousand people are suffering from neurological disorders in all over the country, and that is what exactly we are now looking at it, and it is increasing. Why is it increasing? As the people age, we age now. Nowadays we are seeing aged patients more and more, and such patients, when they live longer, the nervous system disorders are very common, which can affect the brain, and then it can also cause us some degenerative disorders. There are various degenerative disorders in which can affect the brain and the spinal cord, and that is what exactly we are seeing more and more, and that is the reason these patients require nervous system or neurologist care, which is available in Odisha and Bhubaneswar and in many other parts of the Odisha also. So that is what is the importance now in the neurology, which is increasing, as well as the people are getting aware of it, and hence they are coming to the hospitals like KIMS to seek the treatment here. That is the best part of it, and we must create awareness among the public about these disorders and why they should come here and why should they take the treatment early in the diagnosis so that they can be benefited.
Sir, how do people identify they are affecting with epilepsy, and what is the most common causes, sir?
Yes. Epilepsy is due to an abnormal electrical activity which affects the brain. So anybody can be affected from birth till death. I say always that even from a newborn baby, even till the end of the life, they can be affected with epilepsy. So such a common disorder is the second commonest disorder among the nervous system which is get affected. First common is a headache. Headache, every one of us have experienced headache sometime or the other. But next common is epilepsy, and this epilepsy affects almost 1% of the people, 1 per 100 or 1 per 1,000 people, not 1%, 1 per 1,000 people are affected by in the community. That is what we need to see. So that means it is a common disorder, but lot of stigma is there. Lot of stigma in the society about this disorder. That is the reason we need to create awareness among the public regarding this disease. And this has got various synonyms. That means it is called in different names, like they call as seizure, they call as convulsion, they call as fits in a common layman terminology. All are same. So only when the seizure occurs more than one time, then we call that as epilepsy. And epilepsy is always more than once. So it occurs again and again. That is what is important. And it can occur at any time of the day, either day or night. We don't know when it comes. I always say it is like tsunami.
Yes,
So
sir.
how the tsunami can occur at any time,
Anytime.
epilepsy can occur at any time. That is the major problem the patient feels. And because of that, the people or the family gets worried about epilepsy. Why suddenly it happens? How can they go out? How can they go to school? How can the child go to the play home? How can they do that? Every day, like day in and day out, they have a problem. So you ask me, what are the common causes for epilepsy? The causes are many, but the problems are very few causes could be identified. And usually we say in 70% of the cases, we don't know the cause. and that cause is known as cause not known. Cause not known is the cause for epilepsy, because most often these cases could be due to the gene which is present, which can cause a seizure. We call that as idiopathic epilepsy. That is the commonest cause. Other than that, it differs depending upon the age of the patient. If it is in a child, one of the common causes at the time of birth, you have a problem. The problem could be in the form that the child doesn't cry.
Yes.
If the child doesn't cry,
Right.
if the child doesn't cry, then the child will have a problem, because the low oxygen supply to the brain leads to epilepsy. The second common cause is low blood sugar, for example, or whether it is due to low calcium or a phosphorus, that can produce the epilepsy, which is called metabolic causes. Or it could be due to infection. There could be some infection which causes the epilepsy in a child, which is a newborn child. As the child advances, the next common causes are there. The common causes could be in the form of, for example, a trauma. You meet with an accident, which is a very common. When you meet with an accident, if there is a head injury, that head injury causes epilepsy. That is why it is preventable. We should emphasize on this preventable cause, that is a post-traumatic epilepsy. And there are certain infections which can occur by eating a food on the roadside. For example, people all eat pani puri,
Yes,
which
sir.
is very, very common. But at the same time, you can carry some infection, and that infection could be in the water, and that produces what is known as tapeworm infection. And that tapeworm infection is one of the causes for epilepsy in adult people, in older people. Then the other common cause is a TB, for example, tuberculosis, which can affect the brain, can produce epilepsy. Then comes the epilepsy could be due to other causes in the form of, for example, tumor. The brain tumor could be there, or stroke could be there. Stroke is one of the causes. After the stroke, some people start developing the seizure, or after the tumor removal can cause also epilepsy sometime, or a surgery, if it is done for some other purposes, can produce the seizure. So the causes are innumerable, and these causes vary from age, from the newborn baby to the elderly. So it depends upon that what age the person gets the seizure. We always look at it, and we always ask for a family history. Though in the family it will be less than 5%, but even then we always ask whether is there any members of the family who is suffering from epilepsy, who was suffering from epilepsy. In a child, one of the important causes we should know that some fever can produce a seizure. We don't call that as epilepsy, we call that as febrile seizure. They are different from that of epilepsy. Like that, there are many causes which can affect, and it is our duty to find out what is the cause for epilepsy in a given patient and treat that.
Sir, what is your views, as you have treated so many patients, sir, what is your views regarding a woman in epilepsy? This is the most searched term in Google, that women affecting epilepsy. Sir, what is your views?
Yeah, it's a very, very important question you have asked. The woman and epilepsy has got a lot of bearing. What is the importance? The woman can get a seizure during the puberty, at the time of when the maturity occurs. They can get a seizure. And there are changes in life of a woman which occurs all through, which is different from the men. That is what is very important, because the life events are different. So because the life events are different in women compared to men, so we need to concentrate on various ages of women and how they grow, and why women can produce, we have an epilepsy which can affect. For example, if the woman has become a pregnant,
Yes.
then the problem would be not only we are treating the woman, but also the baby inside.
Yes.
And that baby inside can be affected when a woman gets a seizure. And the drugs which we give also affects them. And that is a very important aspect. So because of that, we need to be careful as the doctors, as a neurologist when we treat. And these women, they have to come and approach the doctors whenever they get epilepsy, because when they grow, as the age advances, we also need to change the treatment, and based on their lifestyle, their activities, and what they are going to do. For example, a woman wants to become a pregnant, they should inform us, and when they inform us, depending upon what we are treating, what type of epilepsy is there, we always change the methods of treatment, and we change the treatment depending upon that what drugs is suitable which cannot cause a damage to the child which is growing inside, and that is important. And as the age advances in a woman, always the bones become very brittle, the bones become thin, and that is the reason where the anti-epileptic drugs what we use also should be careful. So women in always have to be looked at in a different way from a men. The reason for that is at various lifestyle, various changes occur which are known as hormonal changes. And that is why we need to be careful. Depending upon that, we change the treatment. We also make the diagnosis differently in women when compared to men.
So what are the treatment options? What are the treatment options in epilepsy?
Epilepsy is a treatable disorder. That is the first thing I wanted to say. Just like your blood pressure, just like diabetes, we can treat epilepsy. There are very well treatable, good, effective drugs are available in the market now. There are so many drugs are available, so patients can be treated. The first and the foremost thing, a person when he gets epilepsy need not worry. They have to come to a neurologist, seek the treatment. That is what is important. Early intervention is very, very important. They have to come early, and there are various drugs are available. These drugs can be used. There is a medical line of treatment which includes the various drugs which we give. Only thing is, like hypertension, like diabetes, we need to give these drugs for a long time. It is not that I will give an antibiotic for 5 days and stop. This treatment has to be continued for a minimum period of 3 to 5 years without missing even a single day, which is extremely important. And if you take the treatment what is being advised by the doctor regularly, and then the treatment, this epilepsy can be controlled. I use the word controlled rather than cured because like hypertension or like diabetes, it can be controlled very well with the medication available. Then those who are not able to control with the seizure, maybe about 20% of the cases, we have surgical treatment also. Surgery can be done. That area, from where the patient is getting a seizure, if I identify that, I can remove that. I can remove that area, and then the patient can get free from the seizure. But that is possible only in about 20% of the cases, not every patient. Those patients who have a problem, then those patients from that area we can remove. But identification requires lot of investigation, and once we do all these investigations, then the patients can be identified and those patients can be subjected to surgery. That is only for those who are getting seizures despite the use of medication. That means minimum 2 or 3 drugs we try, and if patient is not controlled, surgery can be done. Then there are also new technology which is available now. There are something called VNS is available, neuromodulation is available. Those are all the newer technology which can be used in the treatment of epilepsy only in the selected group when the medicine fails. There is some diet also, the diet called ketogenic diet, that can be used but more effective in children. In small children, if the person is getting refractory epilepsy, that means epilepsy is not controlled, then in those patients we can give this dietary modification also, and that is called ketogenic diet. That can be done, but medication plays a very important role, and these medicines have to be continued for a long time. It is minimum of 3 to 5 years. So always we counsel the patient. We tell them that these drugs have to be taken every day, like a diabetic person takes a drug or a blood pressure patient takes the blood pressure treatment. In blood pressure and diabetes, it is almost for life. But here, it is only for 3 to 5 years. So which is better disease? The better disease is epilepsy. But why the problem? The problem is the people think in a different way. People think epilepsy has got lot of stigma in the society. That stigma is the problem.
Another question is also there. So how a common man can identify the epilepsy?
It's very easy to identify. Most of the person can have epilepsy in the form of sudden drop and become unconscious, and then the eyeball goes up and they can get a convulsive movement, and that convulsive movement involving the hand and the legs. And what is important is epilepsy is a disease which occurs for only few seconds. It may be for a minute, it may be for 2 minutes. After that, the person recovers completely. on its own. There is no need to worry about it. They recover on their own. So it can occur at any time. As I mentioned, like a tsunami, it can come all of a sudden and suddenly the patient recovers. It is a very transient or a short duration illness which occurs again and again. It can repeat again and again.
Okay.
That is the problem.
Sir, are epilepsy patient can marry or do a job?
Yes, that's a very important question which you asked. Epilepsy person can lead a normal life like anybody else. They are as normal as in I and you. So there is no difference at all. They can definitely marry. Only thing is what I suggest always is please inform the other party.
What are the do's and don'ts an epilepsy patient can?
So the most important is the epilepsy people have to take the tablets regularly. They have to eat food regularly. They have to have a lifestyle which is very, very important. That means they have to maintain certain lifestyle and wherein they have to take food at the right time. They should not starve. They should not have fasting. That is very, very important. I always say that don't fast like just because there is once in a month they want to fast. That is not good for epilepsy people. Then they have to sleep. Sleep is the most important aspect. They should sleep minimum 8 hours in the night. So, for example, a person is working in the IT and BT and they are working whole night. Such people will have problem. Or a person who is doing a night duties in a telephone exchange. Such people will have problem. Those people have to change their occupation in a way they have to shift the change and they do it at day work. So sleep is extremely important. Then stress is one of the things which needs to be curtailed. So we always say don't stress yourself and always they reduce your stress. So three important factors is avoid sleeplessness, avoid hunger and avoid stress as far as possible. If you do that, then you can lead a normal life. Then driving. Driving is usually, we say that don't drive any vehicle for at least 1 year. 1 year from the last attack of the fit, you should not drive. The reason for that is, it is not that you are having in trouble, you may land up in trouble where the community or the public may be in danger. Because you may get a seizure when you are driving and suddenly the car or the scooter, two-wheeler may go out of control and hit against a normal person who is walking on the road. So because of that, we always tell them that not to drive vehicle, and after 1 year they can drive vehicle provided they wear a helmet, they have to wear a belt in the car, which is very, very important. These are all necessary to prevent the injury to the head. So it is the prevention which is more important. They can swim, but they have to inform somebody when to have a look at them when they are going into water. That's all it is required. But I always tell them certain sports which are called recreational sports. Recreational sports are like bungee jumping.
Yes.
For example, jumping from a very high level, or rock climbing, or they are having into scuba diving. Those are all called recreational sports. Such sports, there is a danger involved. So you should not involve yourself, because by chance if you are diving into the water and get an attack, then it will be a problem. But there is no harm in playing cricket, there is no harm in playing football or a hockey. That is no problem at all. You can play indoor games, outdoor games, you can study, you can use computer. There is no problem at all. There are false beliefs, there are many false beliefs are there in the society. So that has to be taken out, and that is called myth and misconceptions. There are people who believe that on solar eclipse day, lunar eclipse day, or on a full moon day, they get a seizure. We have studied all those things. We have done scientific study on all these things, and we have disproved that there is no effect of either lunar or solar days on this epilepsy. These are all the myths and misconceptions which we have among the public. That has to be removed. That is very, very important. There are so many of them. Some people say that when you get a seizure, show them the shoes or some onion. So there are many beliefs in different parts of the country. In southern part, they always say you show the onion to them and onion will give, or you give a metallic object into the hand. These are all false beliefs. That is nothing. I always tell them you can give a wooden piece or you can give a metallic piece, everything it will stop, because it will stop after certain time. whether it is few seconds or a minute or two. So then automatically it subsides. By the time you search for all those things and give it in the hand, the whole thing will disappear. So they think that onion has helped, or a metallic piece has helped, or a shoe has helped. These are all false conception, myths and misconceptions which are there about epilepsy. Epilepsy is a disorder which can be treated very well, and that is what the public should know. And all these beliefs should be taken out, and you must approach the doctor, especially the neurologist in a bigger hospitals like KIMS or Kalinga University, where you have lot of neurologists are there and they can provide the treatment. Early always you go, better is the treatment. Early diagnosis, prompt treatment cures epilepsy. That is all I want.
So what is your final suggestion or any suggestion you just want to give to the common people about epilepsy?
Yes. The common things are that epilepsy is a treatable disorder, number one. Number two, there is no need to be afraid of epilepsy. Remove the stigma. There is lot of stigma about so in the society about epilepsy. These are all false, and there are a lot of misconception and myths that needs to be removed. What we need to know that is epilepsy is like any other disorder, maybe comparable to hypertension or diabetes. Long-term treatment is required. Lifestyle changes, minimum lifestyle changes are required. They can lead an active life like anybody else. They can marry, they can have a child, and they can do computer job, they can study, they can play cricket, they can play anything they like. But what is most important, don't forget to take the tablet, then they lead a normal life like anybody. And it is not dangerous condition, and there is no danger to the life of the individual in this patient. That is very, very important. This is the message I give to the public, that it is a treatable disorder like any other disorder.
आपने शुणुले सर सो मेनी थैंक्स टू यू आपने शुणुले आम सहित प्रोफेसर डॉक्टर पी सतीश चंद्र सर थे सर ये जो गोटे बहुत बड़ा आम आलोचना कले किंतु मुख्यतः सर जब जानवा चाहिए तेरे आप सर कौन सजेस्ट करा चाहिए आपंकर व्यूज कौन रहा जो टॉपिक को लेकर आलोचना कर
थैंक यू आपण मैंने जमी शुणिले प्रोफेसर पी सतीश चंद्र सर जो सब कथा सब कहले सेटा हूँ बहुत गुरुत्वपूर्ण कथा जदि आम देखुच आम पाखक बहुत फिट्स पेसेंट आसुंच आम पाखक आसिया पूर्व से जमी है ना जमी गोटे गुणिया पाखक कि क्या पाखक झड़ा फुंका वाला पाखक जमी जाऊँ तेणु आम चाहूँ से जिनसटा न हो समस्ते एपिलेप्सी को अर्ली डायग्नोसिस रोगटा को चिन्हिकी न्यूरोलोजिस्ट पाखक आसतु सार आम पाखक आसुँच सबुठ बड़ फायदा आमर हो दीर्घ 40 वर्षर एक्सपीरियंस तांका पाखरे अच्छी लक्ष लक्ष फिट्स पेसेंट मानक से ट्रीट करके भल कर ओडिशा पेसेंट जाऊँच बैंगलोर को तांको देखापी किंतु सेमाने भी जानी ना सार भुवनेश्वर को आसुँच प्रति मासरे आसुँच लास्ट 2 वर्ष धरी आसुँच तेणु आम चाहूँ आम ओडिशा रे जो फिट्स पेसेंट स्पेशली जो माने रिफ्रैक्टरी पेसेंट जार बारंबार मेडिसिन चेंज कले भी ठीक होनी केमिति बेस्ट करहब आ कौन ऑप्शन रही इंडिया रे आउ को जगार बेस्ट ऑप्शन रही तार परामर्श सार ही होचंदे बेस्ट लोक जे आमर पेसेंट मान को दे परिवे तेणु आपण माने जदि कौन भी फिट्स पेसेंट कोठी देखुचंती सार को आसिकी परामर्श करें तांकर हेल्प नहीं पारे बाहर को न जाकि आमर भुवनेश्वर मध्य तांकर हेल्प नहीं पारे आमे चाहूँ सबू पेसेंट कर सीजर केमती कंट्रोल होइकि रहू विथ मेडिसिन जदि तांको आउ किछि अत्यधिक एडवांस ट्रीटमेंट दरकार ताहा मध्य आमे केमती बाहर को पठेकी करि परिबु ता प्रति ध्यान दे परिबु थैंक यू सर थैंक यू फॉर दिस टॉक थैंक यू
निहत भाव में आपण मैंने जहाँ शुणुले आम एने आलोचना करते आम सहित प्रोफेसर डॉक्टर पी सतीश चंद्र सर थे आम सहित डॉक्टर संतोष सर थे आलोचना करते किंतु मुख्य कथा आपण मैंने डरबार आवश्यकता नहीं ये रोग भल हो पार आप सुस्थ हो पारे किंतु जो अंधविश्वास रही से अंधविश्वास बाहरी जातु एवं आसी डॉक्टर को देखा करूँ एवं आपणकर जहाँ भी रोग होती एपिलेप्सी नहीं जहाँ भी डाउट अच्छी आपण मैंने निहाती से माने क्योर हो पारे एवं जदि भी आपण मन में कौन भी एपिलेप्सी रिगार्डिंग डाउट आसूची एवं आपण मन कौन भी प्रश्न अच्छी निहाती भाव कमेंट बॉक्स जनातु आम सार को निश्चिंत पचारू कैमरा सम्मेलन सहित विश्वजित प्रतिदिन टीवी।